Well, good afternoon, Christina McCoy with mHealth Fairview.
Hi, good afternoon. I'm Brooke Cunningham. I'm a physician and a health disparities researcher at the University of Minnesota and mHealth Fairview.
Hi, good afternoon. I'm Jonathan Palmer. I am the Executive Director of Hallie Q. Brown Community Center, where we're broadcasting from.
Good afternoon. I'm Dave Hamlar. I'm a physician at University of Minnesota, mHealth, and I'm in the Department of Otolaryngology, which is ENT.
Fantastic. Well, thank you so much for joining us this afternoon for this conversation. Mr. Palmer, thank you so much for hosting us at Hallie Q. Brown. I know your organization has been the lighthouse of the community for the last 92 years, and so I can't think of a better place for us to have this conversation today. So today we're here to talk a little bit about the COVID-19 vaccine. My community has been hit hard this past year. So 2020 was a difficult year. We're learning more, and so there's definitely hope and reason to celebrate, but we have much work to do. And so I really appreciate you all taking the time to have this conversation. Just so happens that we're having this conversation in a community that I have deep roots in. I've worked and served this community for more than 20 years. And so just really appreciate your partnership on this and taking the time to have this conversation with us today. So I'm going to ask you some questions today about the vaccine, but before I do that, I heard that all three of you have received your vaccines, and I'd just like to hear how that experience was for you. So Dr. Cunningham, I'd love to start with you. What was your experience like?
So I'm going to be candid during our conversation. I just got my vaccine on Monday, the first shot. In my clinic, which is the Community University Healthcare Center, they started probably the first week of January. And I was not the first person in line. They ended up having 2 educational sessions that I wanted to view. I wanted to research the vaccine myself. I wanted to look up the companies. So Pfizer, been around for a long time. Moderna is new, right? I wanted to read the sort of vaccine inserts. I wanted to watch what was going on in terms of other Americans getting the shot. I wanted to follow the coverage once that started. And so it took me a while. So my partner's parents got the vaccine before I did, right? They're elderly, they have some comorbidities, and we had some conversations about my own sort of delays. But I will say, particularly when it became evident that we had the new variants in this country, which are amped up COVID-1, it seems like, that was also scary to me. So having sort of done my due diligence to make myself comfortable, because we're going to talk a lot about concerns about getting the vaccine today, and what I want to say is I'm a physician, but I also share the concerns of many people in the public. And we all have to take whatever steps on our journey to get comfortable. And I had to do that for myself. And then Monday I got the vaccine, and I'm fine. It went well. The alcohol, I think, was tingling, my arm more than even getting the shot in the needle. So I just got it, and 4 weeks from now or 3 weeks from now, I have to get the second dose. So it's fine, but I was a slow adopter.
Well, and I think there's nothing wrong with that. And in fact, I think you share a lot of concerns that a lot of Americans have. And so being informed, despite having a lot of resources at your disposal and ways to access information, it's a very personal choice. So I really thank you for sharing that with us. Mr. Palmer?
So yes, I had my first shot a couple of weeks ago. We were fortunate enough to be chosen, randomly selected as part of a pilot program for educational institutions. So we have here right now an early learning center and a school age program that are operating in addition to our food shelf. So we've been open the entire time of the pandemic, on the front lines doing the work, and we were randomly selected as part of a pilot program around that. So most of our staff have been able to get that first shot. My second one is on March 1st, so I'll be going back for that. But went down to the Roy Wilkins Center, got the shot. It was fine. They had the National Guard down there who has been trained to do this, as well as other physicians. And I didn't even feel it. In fact, when it went in, and I said, "Oh, is that all it is?" So perfectly fine. Like Dr. Cunningham, I also, researched information to look at it. There's a lot of history within our community of issues that have come up around medical experimentation, around, what is being told to our community. And so there's a natural piece, which we'll talk about a little bit more later in terms of being careful and cautious. But the research all said this was the thing to do, and this is the time to do it. So I've had no adverse effects, and looking forward to the second shot.
Fantastic. And if I could just ask you a quick follow-up, what was it like to navigate that process of getting your first shot? You mentioned you went to Roy Wilkins Auditorium. Was it a difficult process to follow, or was it fairly straightforward?
For me, it was fairly straightforward. I got down there, and I think it depends on the day you go. One of my other staff went down there and had a much longer wait, and somehow ended up on the news because they were covering, I think she was one of the first days. But when I went down, it was very easy. Everybody was really friendly. I mean, I was amazed at just how nice everybody was and how friendly and accommodating. So it was a very smooth process, no issues whatsoever.
Fantastic. Thank you very much. Dr. Hamlar?
So I'm an early adopter, only because of history and my own personal history. So I've received both my shots, and actually the last one was almost a month ago. So I was very early on. But I looked at all the build up to the vaccine coming out. So I was doing my research in real time, looking at maybe what I do. I do have a military background where you really don't have a say. If you're going to deploy somewhere, they just stick something in you anyway. So that's sort of my psyche as well. And I've had numerous shots that other people don't get anyway. Surprisingly, when it came time for the shot, there were some issues, and it was at another facility. So you have the ability to sign up wherever, right? If your clinic can do it for you, great. If they can't, then you look at the next. So I ended up getting at another facility, not mHealth itself. And that came about in a way that you sign up and then they call you. So it was smooth, but at the same time, you were kind of on edge when to show up, that sort of thing. It wasn't a standard appointment. And one of the things we went around on is you have to show back up in 3 weeks. You have to be there on this day. Now, I wasn't going to be around, so they were saying, well, you can't get the shot today. So there are a lot of parameters put around that I thought were unreasonable, at least for me, in my research of the vaccine and how it's going to be distributed. There's, 1 day doesn't make a difference, 2 days doesn't make a difference. So that was sort of in the back of my mind, and it was definitely on the minds of the providers who were giving it. That said, everything went smoothly. The first shot was not a problem. Second shot was even easier. It seems like your body built up some antibodies already, and whatever had to happen to transform already did in my body. And we'll talk about that a little bit later, how much immunity you get with the first shot versus the second shot. But it all went pretty smoothly from my standpoint. Follow-up, one of the things we had to do in my field specifically, I said it was ear, nose, and throat. So one of the areas that this sheds is the ears, nose, and throat. So I had colleagues dropping like flies, not able to be in the clinic. So it was good for us to get it early, and I think we were prioritized because of that. So there was some benefit to being, on the front line in terms of the patients you see. But at the same time, there's other people who are deserving as well. And we want to make sure they have their shot at it, no pun intended, to get this done.
Well, thank you so much for sharing your experience, and I appreciate you sharing the timing of getting that second dose, because that's something that I have concerns about within my community, just if will have enough for people to get their second dose on time, but also if there are obstacles to individuals being able to access transportation to get to the vaccination site. And so it's good to know that as we learn more, we're learning that there is a little bit more flexibility in that second dose.
And I think we're still learning that. Obviously, you had a phase 3 trial, meaning you've looked at human distribution. You're going to see what happens, but I think we're going to learn from the data they're still collecting. So that would be a good thing that we're going to benefit others down the line.
Yes, absolutely. Well, thank you all so much for sharing your personal experiences. Now I'd just like to move into talking a little bit about the actual vaccine. And so, Dr. Cunningham, would you mind telling us just how exactly does the vaccine work in our bodies?
So the vaccine, we've heard on the news that it's an mRNA vaccine. And basically what mRNA is, it presents a code that tells your body what protein to make. And the coronavirus vaccine, it looks like when we see it on the pictures, it looks like a ball with little spikes sticking out. And so the mRNA vaccines basically just have that little piece of the spike protein. And that's enough for your body to start producing antibodies. So if you were ever exposed to coronavirus, your body has already seen a little piece of it. Not enough to get you infected through the vaccine, but a little piece to make those antibodies to ward off getting affected by the coronavirus circulating.
Thank you. So just to clarify, there's no actual virus in in the vaccine itself?
Right.
Okay. Thank you. And a couple of follow-up questions just about the vaccine. Is there any pork in the vaccine?
No.
Thank you. What about fetal tissue?
No fetal tissue.
Okay. Thank you. Does the vaccine cause infertility?
No, we haven't seen that. No studies have shown that it causes infertility. And there's no reason to think that it would at this point.
Absolutely. Thank you. So Dr. Hamlar, for you, I've personally heard a number of concerns about the safety of the vaccine as it relates to actually getting COVID. Can I get sick with COVID? Can I become sick with COVID from taking the vaccine?
Not from taking the vaccine. As Dr. Cunningham noted, it's just giving you a picture to trick the body into producing antibodies. So there's no danger of acquiring a disease process in your body. At the same time, we wonder, and it's still under investigation with all these variants you're hearing about, is there enough of a signal to actually ward off these variants that you're hearing about? And all these viruses have some commonality to them. And so that's the hope, is that it will ward off the future variants that you're seeing. But no, there's no disease within what we're receiving, but it is telling the body to fight off that disease.
Thank you. So as a follow-up, can you just speak a little bit to the safety of the vaccine? How safe is this vaccine?
So, everybody worried about, especially when the political end up was really being pushed forward, the rapidity that we have gone forward with this vaccine. In actuality, since 2002, when we had original SARS, and remember MERS, which was coming from the Middle East, those processes were being investigated then. And we're looking at mRNA as a way to fight this off even back then. So this has been a long, steady climb. It's just the government, along with private industry, was able to team up and put more resources together to help speed the process. All the checks and balances that usually go into development of any medication or drug, or in this case a vaccine, were still held in check. And there's internal review boards, and they bring people in for these investigations, phase 1, phase 2, phase 3, which just happens to talk about the degree of in-depth study that they're doing on it. Those all proceeded in the same fashion. There was no variation there. So to me, when I talked about I was an early adopter, I was following that all along, and I felt it was safe the way it was put together, and now the product that we have.
And just to follow up, because it's so new, should we have any concerns about the long-term impacts of this?
You're always going to study any medication you give. I mean, we could take any medication that's on the market today, and there will be some variance that happens. And we do follow adverse effects. And that's the one that we really, cry foul about if it happens, because we don't want that to happen. So if an adverse effect happens, there are reportable schemes that are in place for people to let people know. And you remember when they were doing the original studies, some things were quote unquote shut down. They were put on pause because they had an adverse effect. We don't want it to keep continuing. And so through that series of developments, we found out that yes, this is safe. Now, if something were to happen to someone else who didn't have the same makeup or had a variant in their genetic structure, then fine, we'll find that out and do it. And that brings me to the point that part of our goal here today is to make sure people are accepting of the vaccine, but there's a lot of work that goes into development of any medication or vaccine. When you do those studies, you want the population as a whole to be part of that study. If you look across the landscape, and I was on an IRB, which is an internal review board that looks at these studies, if you look at the makeup of the patients, if you want to call them patients, or the subjects, they're always about 9 or 10% Black, maybe 20% Latinx, but they're not the bulk of the people who are being part of that. And one of our jobs is, as physicians, as researchers, is to make sure we have the population who's going to receive this be whole. So we look at everybody, and we know we don't have variants that hurt someone else versus someone else. So to the fact that we had 9% Black, 20% Latinx, we know those people, that population has been studied. So I am comfortable saying, yes, it's safe for me to take.
Thank you. Thank you very much. So, Dr. Cunningham, I've heard a number of concerns from community about the vaccine possibly altering someone's DNA. There have been some talks of it making people sterile, and possibly even implanting something inside of them that could be trackable. Some even thought there might be a microchip. So is this something that's possible? Is this something that we should be concerned about with this vaccine?
I understand where those ideas come from. I understand where they come from, but it is not something that we need to be concerned about. The one thing that, again, when I'm looking at this to understand it before I take it, it was very interesting for me to learn how quickly sort of the product, the vaccine itself, degrades, the mRNA degrades in the body. And so there's no reason, again, to think that it would have these sort of long-term side effects. And there's definitely no reason to think that something nefarious or bad is happening, particularly to people of color, through the coronavirus vaccine. And just note, everybody is clamoring, actually, for the vaccine. And so it's not just going to people of color. And it's great that there's diversity in the trials, but I also want to make the point that these differences that we're seeing in sort of health outcomes, including COVID-19, morbidity, mortality, are not about genetic differences sort of between Black people or other people of color and white people, right? And similarly, when we think about vaccines and drugs, we want diverse samples, but not in the way that we would think that, oh, there's something significantly genetically different about Black people than about white people, right? We want diversity because the human population is a diverse population, right? But we shouldn't be thinking about that genetic diversity in terms of race. So I just wanted to also throw that in. Just a couple of key things, right? We're seeing COVID-19 morbidity and mortality because of the social context in which people of color live their lives. In terms of everyday stressors, in terms of racial stratification and educational opportunity, racial stratification in employment, and access to care, and wealth, right? These are the reasons. Who's the essential workers, right? Like 16% of the healthcare workforce are Black. Now, they may not be physicians, but those workers also have a lot of contact with patients. Think about child care centers, right? Think about staff in the grocery store. And so those sorts of reasons are why we have higher risk, not a particular genetic susceptibility. Similarly, there's no reason to think, given they were mindful of just human genetic diversity in the trials, that this vaccine would not work for us. And given its widespread distribution, also no reason, I think, to think that it would be particularly targeted to be harmful to people of color, right? We're seeing in some states, the people who are getting it are the more resourced, the predominantly white population of those states. You know, we've heard about things happening in different states. And so to the extent that for some that will not be reassuring, but it is suggestive to those who might think something ill will could be going on towards populations of color, that is unlikely.
Thank you. And I think you underscore an important point about different individuals having access to the vaccine at different times. And I think it's worthwhile to note that just different states are in different places.
Right.
And a lot of this has to do with the availability of the vaccine as well. And so it brings up questions of equity and access. And so I think that needs to be in the front of our mind as we're looking at how we can look at equitable distribution across the state. So thank you for that. Dr. Hamlar, so a question for you. A lot of people are talking about the speed at which these vaccines moved through the trial phases, and there's some concerns about the speed because we've never seen anything like this in our lifetimes, at least. Does the speed in which this was developed and passed through trials affect how safe it is, in your opinion?
Well, as I alluded to before, I think all the checks and balances have been met. The speed was because, number one, we had already been studying using mRNA tracer before. Now with, like I said, government and private sector getting together, I think we sped it along. Plus other countries were doing it. We're using cross pollination, so to speak, from the other countries, not just the US. And there's one study that's still out there. We talked about Pfizer and Mrna, but the AstraZeneca study is still out there. And they're ramping up as well. But they're going through that trial process, and that's not going to be released until it's safe. So that just shows you that I fully feel good about the safety of the vaccine. The thing that I think we need to know is what Dr. Cunningham alluded to before, was that in distributing this, we have to make sure everybody is on board and they can have objections to it, and it's our job to help answer those objections. But still, it's the product itself. Right now, I think the reason we're not distributing as much is we just don't have the product right now. And we're looking for areas in our communities to help that distribution. And I know numerous organizations, from Open Cities, which is in St. Paul, to North Point, which is in North Minneapolis. Those entities are looking to get more product, and they serve our communities directly. Then there's an organization called Black Nurses Rock. And Kelly Robinson was just able to get agreement from the county to help distribute it on her own. And she could come in a facility like this with Jonathan, be able to provide that to the community. So we need product. And I think there's a lot of people stepping up to the plate to help distribute that in a safe way, because there's guidelines you have to follow and those kinds of things. But I think that would be something that Haley Q. Brown could pull off very easily.
Neat. So just a follow-up to that, might the speed at which we were able to get vaccines out into the public and the process that was followed, might that help us in our fight against future disease or future illness?
You know, that's a whole conversation, but yes, just like I talked about in 2002, we had started the research. And research builds on itself, experience builds on itself, and you're gonna find that what we've done to date is gonna even help us in the future. We talked about the variants earlier. So if there's another variant, we'll be able to follow and see what success we had with this particular vaccine. So that means jumping to the next vaccine if you need it. Who knows? We've been taking flu shots for years. And that, you know, if I look at the data there, 60 to 70% ability to rid disease is about normal. This is 94, 95%. This is remarkable what they're able to do. And I'm not Dr. Fauci or anyone who's talking from the CDC, but if I look at it from my professional, I want to be that 94, 95% who's able to not have, and the studies, do we still transmit it? Can we still get it? I think those are all yet to come. Point is, it's still going to be something that we're going to be looking at down the line.
Thank you. Thank you very much. All right, Dr. Cunningham, a question for you. There's been a lot of confusion about vaccine trials. So we have a few vaccines that are on the market now, some in development. This question is, why are we still doing trials if we have good candidates that we're manufacturing now?
Right. I think from the sort of public health perspective, This is a global pandemic, right? We need as much vaccine as we can get. And so we need a lot of players. And they started with different strategies, right? There were some companies sort of positioned to do mRNA, had been in that space. There were some other companies who, Johnson & Johnson and AstraZeneca, who are using more traditional routes. There's good reason to expect that all of these sorts of methods have the potential to produce efficacious vaccines. And so I think it's like all hands on deck, and it just happened to be that people took different ways to hopefully get to the same outcome. And so I think the advice that I would give is again, you may have to go on the journey that I went on to do your sort of background homework, right? But then once you do that, and you see what vaccine is available to you right now, in our community, it's mostly the Pfizer, Moderna, mRNA one. Go for whichever one is offered to you.
Don't
right?
be picky.
Right.
Fantastic. Thank you very much. Mr. Palmer, I have a question for you. Can you talk a little bit about our concerns with just our historical concerns, our country's concerns with our Black community and healthcare systems, how they've served people of color in the past? There are a lot of people who are concerned about the vaccine, and I'd just like to hear from you. What are some of your thoughts on the community concerns, some of which we've discussed today, and what else you're hearing?
Well, the concerns that come up a lot has to do with trust and has to do with the past practices in our country. So we live in a country that has an underlying systemic racism piece that impacts everything from where you can shop to where you get your health care. And the most famous of these is the Tuskegee experiment come up, where people were given syphilis and injections for that. And so there's a natural apprehension within the African American community about trusting things that are unknown, that there's not as much information on, or that has any kind of scientific experimentation. You've talked already about some of the fears that have come up, microchips being injected in, or things that are going to go ahead and cause sterilization and pieces like that. So our community needs trusted messengers and people that they know that they can talk to and be able to hear from, and that's kind of why we're here today, so that people can hear from trusted leaders, from people who are active and engaged, people who look like them, and be able to know about that. I mean, you can look at what has been happening in this country for 400 years and see how the system has been slanted against Black and brown communities. And every time there's an advancement or there's a system that comes up, it's usually at the bottom of that rung is somebody from one of those communities. Dr. Cunningham alluded to the health within the community. That comes from that access piece. That comes from the systems of poverty that are in place that have made sure that you can't access the nearby clinic because it's too far away and you don't have transportation, or you don't have the insurance to be able to get that, or you're not sure who those people are because they don't look like you, they're not involved in your community on a long-term basis. And so there's a natural apprehension that comes up within our community about wanting to trust this, wanting to take this. They're seeing what's happening, and the information that is out there on places like the internet goes ahead and piles on all the misinformation. And part of the struggle we have is right now in today's society, people look at the 144 characters and that's what they take in, instead of taking the time like Dr. Cunningham did to research, to look at things, to find out what the impacts, what did the studies say? They heard from so-and-so that this is what it does, so that makes it true. That's not the way to go about this. You've got to go ahead and take a look at this, but you've also got to talk to the people who actually know this. We've got 2 medical professionals here who are talking about this is what it does. These are facts. These are information that you can take and you can trust. And that's the way to combat the fear and the apprehension that exists within the community.
Can I jump in for a sec? Because I just wanted to piggyback on a couple of things and piggyback on a question that you asked. So, because I see the Black community as a very critical consumer of information. And so people want to talk about it as mistrust, but I like to frame it as like being a critical consumer of information, in part because it is not, your questions about sort of sterilization and fertility don't come from out of the ether. They come out of the history that you're talking about of physicians, right? Health services sterilizing Black women over time. So it's not beyond the imagination that this could happen again. The idea about could something be being injected into us, that also does not come out of the imagination. It comes from hearing, right, that Black people were given syphilis. It was that they were not treated, but it's like hearing this, right? And so the history of medical experimentation on the Black body is real. And so the skepticism is warranted. And so we really do need to thank you, Mr. Palmer, for giving us some of that history, right? Because that is the context that we need to really put at the forefront when we start thinking about community or framing sort of community readiness for the vaccine.
Absolutely.
And if I can tap onto that, you're very right, because of the fact that's also the frame of reference that needs to be looked through when you're administering that. So if you're doing the outreach, if you're going to do clinics out in the community and go ahead, that's the lens that you have to understand. The history of it is very real. The skepticism is very real and justified because of the past practices and because of what has happened. But that's a frame of reference that medical organizations need to be aware of so that they understand and they don't just dismiss outright the concerns of people, but rather can talk through them, take the time, explain what is happening with the vaccine, how it can be utilized, and go ahead and address the concerns. Otherwise, what's going to happen is people are not going to take it. And they're going to tell their family members not to take it. And what you're going to have, and in the Black community, our families are very close. And so if grandma doesn't take it, then Junior's not going to take it. And that's part of the piece. So there is that lens that needs to be looked through. Thank you for bringing that up. That needs to be understood as you're explaining this, as you're talking through this, and taking a little more time and understanding the reality that we come from.
Absolutely. And now you lead a large nonprofit right here in St. Paul. And especially during COVID, the number of community partners as well as our residents have turned to Hallie Q. Brown for support and guidance. And so as it relates to the vaccine, what are some strategies you think we could use to perhaps partner with a health system to help build that trust and get information that's accurate and timely out to the community, considering that people consume information from a variety of sources?
Thank you. So we've been working with both Ramsey County and the Minnesota Department of Health as a trusted messenger to share information out about testing, about the virus itself, and about vaccines, and being one of those sources that people turn to, that they look for real information, they trust the information that comes out. So partnering with trusted sources within the community to talk about the actual science, to talk about what are the places people can get tested, what are the places people can get the vaccine, talking through the concerns like we're doing today so that people can hear the answers to their questions that they have. And being able to be with community institutions that have been around, like ours for 92 years and longer, to know that they can trust that the information is coming from a source that is going to be valid and a source that they can count on. So we've been doing information out into the food baskets that we distribute. We've been sending it home with the parents that are in our educational programs. We have it on our website, on our social media, things that can go out into the different networks that we have, and working with the Black Press, Insight News, the Minnesota Spokesman Recorder, and others to be able to share that information from sources where people will hear it and they'll listen to it and they'll have those conversations in their neighborhood, they'll have those conversations in their households.
Thank you, and thank you for filling that space. I mean, I think that this is a time when we need to have those, to your point, the trusted messengers more now than ever. And folks are used to coming to Hallie Q. Brown for services and support and information. And so it's only natural that you're an extension of being one of those messengers in our community. So thank you so much for that work. I have a couple of other medical questions. So we talked a little bit about the safety of the vaccine as it relates to pregnancy and some concerns around sterilization. Dr. Hamlar, could you tell me if I'm looking to become pregnant or if I am pregnant, are there any things I should be concerned of as it relates to the safety of this vaccine? Should I even get a vaccine?
So I would say with most drugs, most vaccines, they're not tested on anyone who is pregnant at the time. But it's something that you'd have a discussion with your practitioner, with your physician, about your certain concerns, your own concerns about that. Now, are we giving it to individuals who are pregnant? It is happening. So the thing is, we are going ahead with it, but we're going to study that. But it's a discussion that you have with your physician about your risk factors. If you have comorbidities, pregnancy, if you look on the list, is one of those risk factors. So you want to make sure that you discuss that, just like if you have an allergy to a medication. You want to discuss that, your particular situation, with your physician. So again, through the way we develop the medications, I'm in support of going through with the administration of those medications when appropriate. But that's a discussion with you and your practitioner.
What about breastfeeding? Are there any concerns around breastfeeding and the safety of that if someone has received the vaccine or if someone has had COVID?
Yeah. So I don't know of any instance that has been studied to say it's transferred through breast milk. At the same time, is that discussion again, if you're with your practitioner, with your gynecologist, your obstetrician, who will have more information about that. But those are things that are being looked at now. And Dr. Cunningham may have more insight in that than I do. So.
Yeah, I think when I've looked at this, it is still being studied, and the recommendation is to talk to your provider. But many of the sort of leading OBGYN, for example, organizations are recommending that pregnant women can get it. And I have not seen a contraindication if you're breastfeeding or lactating. I think the challenge with interaction of even for physicians, but for the public with science, is that the science is always evolving. And so there's always a bit of uncertainty. So what we present today is sort of the state of the knowledge today, and from that knowledge, what we would expect. And so, but studies go on, right? We'll have to fill out vaccine, reports of you got it, did you have any side effects, so that they can collect that information. So the data will only get better. I think in the meantime, though, COVID is a killer. And so, right, so that's very real and very risky and makes me very nervous, right? And so that's the other thing that helped me I did all the research, which was good for my brain, right? Which was good for my mind. But there are other things that affect health behaviors, and one of those things, whether you get it or don't get it, is fear, right? And it's fear keeping people from getting it, but for me, it's also fear of dying from COVID, which is real. Right, which is millions of people around the world, right? Which is real, and so I want people to be mindful of that. I want people to be mindful that these new variants look more deadly than the variant that we've been with today, and so and to just take that into real consideration when they're navigating the uncertainty.
And I just keep following up. I think what we're saying here, from having the vaccine to being administered to seeking out places to get information, there's personal responsibility here. We're trying to provide the information as best we can, and there's numerous outlets for it. We were talking about it before we got together today about all the information that's out there. It's not all coded in one place. But people have to go to where they're comfortable and get that information, and we just want to disseminate it as broadly as we can. But the personal responsibility is seeking that information so that if you are of childbearing age and you want to have a child and there's a comorbidity associated with that, you need to talk to your physician. Just like going to get the shot in the first place. You have to take responsibility, not just for yourself, but for grandma, for grandpa, or people who have other comorbidities that might be in your same household, because you're protecting them as well as thinking of yourself.
Absolutely.
Well, and there's a piece with that where, again, people are, I appreciate you saying about it's real, because a lot of times if they haven't been touched by it personally, it's something that's out there. It's a thing that's not real. When this started, it's over in China. It's not an American problem. We're not dealing with it. With the Black community, it is a lot of the time, if they haven't been touched by it individually, they may not feel like this is something that has to be worried about. But it is something that is very real. And when you're talking about doing this, it's not just about you. As Dr. Hamler said, you're helping grandma, you're helping your parents, you're helping your whole family, because this thing is so intense. And it can move very quickly, and I have friends who have lost loved ones because of this. And so the key piece there is take this seriously, to go ahead, find the trusted messengers, find out the information, but this isn't something that we can afford to just brush past and not look at.
Yeah. And I'll admit, I had COVID. Because of the area I work in, it's very transmissible. And we did all the safety things we could in our clinic to do that. And I had it. And so my fear was all these months, it's been a year now, all these months going home, taking it to my family. So I literally was changing off somewhere else, coming in the house, and trying not to infect my family. That didn't happen. My wife got it, my daughter didn't, but we struggled through that. I was in the basement for a few weeks, that sort of thing. But the fact is, I'm a transmitter, and that's what could happen to anyone. And you have to be, that's a real situation. So you have to be careful about what you're taking up as an ideal versus what the reality is when you're looking at COVID.
Well, we had a case here too. One of our staff contracted from their child, one of their children. So we had to literally shut down everything here. We had everybody go get tested. That person was isolated. Everybody got tested. We informed all of our parents and everybody, but we had to shut down the whole operation. We were very fortunate that it was just that one individual. Never got transmitted in here. Everybody's test came back negative. But when we're in settings like this, that's a very risk. If we contract that, if one of us gets sick and it shuts down this agency, there are thousands of people who don't get food. There are kids in this community who don't get the education. So it's one of those things that we've all taken serious. We've got great protocols in place to make sure this doesn't happen. And you've got to pay attention to the things that are coming.
Well, I'm so thankful that you've recovered and that you have moved through COVID. I think one of the things that we're hearing about, that there have been some side effects related to the vaccine, and some have questioned if it's we already had talked about if you can get COVID from the vaccine. But if you could, Dr. Hamler, just touch a little bit on what some of the side effects might be from the vaccine and how common they are.
Yeah, and with any vaccination, you probably experience some redness, maybe some burning at the site, and that's a little muscle acheness there. And then I understand, because I didn't have that, all I had was loss of taste and smell, and that's how I knew I had it. That's in my area of expertise. But, overall joint achiness, you might have a little bit of fever, those kinds of things. I heard somebody I was talking to had some night sweats. And that was one. But it's usually some malaise, some type of overall fatigue, that sort of thing. To have a adverse effect, that's where they shut down the trials. That would be a little more demonstrable. But I can't think of anything that is more common than just a regular body aches.
Thank you. And so you mentioned that you had COVID yourself. If I've already had COVID, should I still get the vaccine? And
Well,
why?
they're recommending, if you have it and have a positive test, then you wait 90 days. Because that 90-day period is where you may still test positive anyway, so how do you know? And the hope is that your body's making antibodies to that. And that's where, the immunotherapy is important. If you have convalescent plasma to give, go to Red Cross and be able to do that. But at the same time, why retest and that sort of thing. So they're saying wait 90 days before you actually receive the vaccine. So that's the recommendation. I don't think I followed that specifically. I think they wanted to get it to me because you still have to protect yourself. You can still get, inhalation particles or the virus that way. So you still have to wear a mask. You still have to do all the protocol things that you do in your business, in your schools, in your organization. So you still have to do those things.
So thank you for that. And so will this be a vaccine that we have to get every year? Will we have to get this vaccine again?
That's why we're studying it. That's why you're still going to have to look at what's going to be happening down the line. With the variants we've talked about, who knows, maybe you have to fight those off as well. But right now, everything I've read about it is that the vaccine we have is fighting off the variants that we have. Who knows? I don't know what the future brings. Do we have to repeat vaccinations or not?
So to some of your points, that this is not a one conversation, whereas we continue to learn things and we continue to study the science behind the vaccine and COVID itself, we'll need to continue to have these conversations to talk about changes and learn and share what we learn. So I thank you for sharing that. Dr. Cunningham, so after having our vaccines, I just want to ask, are masks here to stay? Do we need to continue to wear masks? That's not the answer. I know a number of people were hoping for. Can you tell us why these things will still be important?
Well, so I think for a number of reasons. Our public health measures are critically important, right? We said these vaccines are 94 to 95% effective in you personally not getting sick from COVID. What Dr. Hamlar also mentioned is, but we don't know if we're just not getting sick, if we're in the 5% that's not protected, if we're shedding the virus to others anyway, right? So we still have to do the social distancing and the mask wearing.
Thank you. About the vaccine, what happens if someone receives their first dose and either doesn't get the second vaccine or if it's outside of the recommended time?
Yes, they should contact their clinic or whoever gave it to them. Right now, the understanding is get the next dose as soon as you can, as close to the window in which you were supposed to get it.
Thank you. And Dr. Hamlar, you touched on this a bit earlier, but if you could just talk a little bit about how will people know when they qualify to get the vaccine, how and where they should go to schedule. I know we definitely have some internal resources within our system, but where can people go to get the vaccine now and where can they look to it in the future?
Well, ideally, everyone has a primary care physician or a clinic that they go to, but that's not always the case. So there are a number of websites that are available, resources. You see it every day on TV, you see it in printed press. In Topeka, I'm with KMOJ. We broadcast every day about sites to go to. We have Open Cities, we have North Point, the hospitals. So it's out there, but we have to be proactive and seek out the information yourself. Now, if you feel like you're not getting the information, then maybe the onus is on us to make sure we reach out to you, and we're trying to do that. So I think a classic example, at least in the Black community, are churches. And we're working with a few churches in the area, and plus, I know I'm speaking to a townhouse on for clergy, and that's going to be important because they spread the message to their congregation, and then it moves on from there. So I think classically, and we're talking about barbershops earlier.
Yes, yes.
I mean, that used to be the internet back in the day.
That's where you heard about everything.
But it's not
Yes.
now. But the point is, by any means necessary.
But I think it does have to be, right? Like, I think a huge concern for me is that a lot of this is online. And we know about the digital divide, right? And so you have to sort of be ready at your computer when the vaccine opens up, right? And so it's also great that sort of pharmacies are going to be doing it, but it's the same sort of system where you have to be online, ready at your computer. And many people have cell phones to access the internet, but it's more difficult to access the internet through a cell phone, to register. I was just talking to a friend in another state that to register, they had to take a photo of the insurance card, right? So there were a lot of steps that made it difficult. And the first people sort of, behind frontline essential workers are elderly, right? 65 and up. So there's the digital divide, there's sort of fluency with technology. And so we have to be mindful of that. So then the question is, right, how can we set up, just like we're doing for kids, right, for school here, right? Like, how can we set up spaces, times that take into account people's barriers? Not everybody is set up in the same way, that take into account equity. So what are the partnerships that sort of the Minnesota Department of Health has to make, that mHealth Fairview has to make, right? Maybe there's registration and sign up in their spots and they come here and people, right, sign up for the vaccine, even if the vaccine isn't given here, right? And so I think we have to be very creative about making it easy for everybody.
Yes.
And we've actually been having some conversations about that with both the city, the county, and the state around what are the ways that we can do that. Looking at some of the places in the community where we could be administering. It may not be here at Halley, but it would be one that we would work in partnership with in order to get people access to that, get the information out, so that they'd be able to access it in the community, which is a place that they know and they trust, and they can access as easily. Sometimes when you're going to some of these places, it's downtown where there's no parking and you may not have the transportation to get out there. So you have that component of looking at where the community-based places we can do that at. Open Cities and North Point are great resources that are out there doing that. And I also want to say, in terms of the networks, the barbershops are still those and the churches, but also the alumni groups. And I went to Morehouse College, and we have Morehouse and Spelman. Every Friday, we've got this kind of Zoom happy hour, and we're talking about this. Well, several of our alumni from the class of '91 are doctors, and they've been giving talks across the country. They're featured on our Zoom meetings, talking about why you need to get the vaccine, why it's important, having conversations similar to what we have. But those networks are getting out into the communities and connecting into the HBCU communities and helping to make sure the information is in the right places and reaching out to the families.
Thank you.
Hopefully there'll be mobile vans, right, in the neighborhood near you, right, soon. Like, I think that's something that is going to happen. I think we're going to see that, and I look forward to that.
Well, and it's happening in other states. And I think that one of the things that we learned through scaling our testing efforts is that we created models that work to serve a number of people in a short amount of time, sometimes in smaller spaces. And of course, in Minnesota, we have our climate to contest with as well. So I think we have a strong foundation to look at other models for getting the vaccine out to our community.
Well, the ice cream trucks.
We were talking earlier about what we did for testing.
Yes. How
mHealth provided the structure for us to go to Progressive Baptist Church, and we did that. It was very successful for chest testing. You can do the same thing with vaccination. So I see that as something that you can continue on.
Well, and in the case of partnering with the church, they helped us drive registration. They helped us enroll patients.
Yeah, and you could follow them down. You could follow up too.
Right, we knew where to find everyone. And so it was a place where people felt comfortable coming to. And so it was just kind of a natural extension of the outreach and the work that church is already doing in the community. So I think that's a really interesting and strong point to make. Mr. Palmer, I want to come back to you and just, we've had a lot of medical questions today and talked a lot about the vaccine, but what else are you hearing from the community? Are there things that we haven't talked about that we should be?
The key things we're hearing besides what we've talked about is really just looking towards the senior population, making sure, our seniors, we usually have our seniors here in the building, but they've all been home because of COVID. And so we've been doing extra efforts to reach out, keep them connected, taking them computers and things like that so that they can keep safe, but at the same time are not isolated. And so the key kind of concern we're hearing is, how do we go ahead and make sure that things are safe for them? How do we make sure that they can access these? For the trial that we're part of, you signed up online. And for somebody like me who's tech savvy, it's real easy, but we had several staff that we had to help with, and we've had seniors who have had trouble with that. The systems aren't always as intuitive and easy, so being able to help people get access to the systems, help them walk through that, supporting them as they try to get signed up for the vaccine and connected into that. So looking at what other extra steps need to be done, in addition to the conversations that need to be had with the trusted people that they can talk to.
And I think to add to that, and then helping people navigate those systems.
Yes.
And so it's identifying the pathway, but also helping people navigate those. So I thank you for stepping into that space and continuing to step into it more. Dr. Cunningham, Dr. Hamlar, anything else that you would want to add that is important for the community to know at this place that we're at with COVID now as it relates to vaccinations? Dr. Cunningham, I'll start with you.
My concern is the same, so that we've just sort of hit on, which is we talk a lot about Black people being hesitant about getting the vaccine. I think there are a lot of Black people who want the vaccine but can't get it. And we're not talking enough about that conversation. We're not having enough of that conversation. It goes to navigating these barriers. So any way that we can support individuals to navigate those barriers. And people will get creative, in their households, right? They'll get Junior on with Grandma on the computer, right? But we have a responsibility too, right? So we can't just rely on community centers to step in. And so what I'm hoping we will see and that the community will see is for us to step in and help navigate barriers. And I think we have to be very communicative about what we're doing, right? So that's what's really sitting on my mind, is there are a lot of people who want the vaccine who cannot get it. And so how are we going to get it to them?
And being honest about what the challenges are,
Right.
Being honest about where we are at with vaccine distribution and acknowledging that the difficulty in finding a vaccine right now is a very real one. So appreciate that. Thank you. Dr. Hamlar, anything you'd like to add?
I know we've been talking specifically about the vaccine, but it goes back to if there's something that happens to someone and you get a sneeze or a sniffle, Black people get the flu and die. It comes down to me, all the racial disparity that there is in healthcare overall. And this has just exacerbated it, because you see the data we talked about initially, how the disparate numbers of access, those who are actually receiving the vaccine, they're disproportionate. So to me, if we can get whatever entities are involved, and I'm talking at the CEO level, I'm talking at the grassroots level, to make sure that folks who don't have access to care get that care. Because that's going to bring down that disparity. It's going to take some of this hurt away. COVID doesn't care who you are, obviously, but at the same time, you're seeing that the numbers reflect that who's getting care now. So I want to see that be the same thing we talked about George Floyd earlier, how that has brought another pandemic,
Yes.
An awakening. I see this as doing the same thing.
And to Dr. Cunningham's point, that the responsibility is all of ours. It's shared.
Exactly.
So,
exactly. We're not going to do it in our little silos.
Right. We can't. Well, I want to thank all of you for being part of this. Dr. Cunningham, Mr. Palmer, and Dr. Hamlar, thank you so much for being part of this conversation today. I hope this is the first of many that we can have. And just thank you for lending your time and your talent to this process. And Mr. Palmer, thank you so much for hosting us. Again, I so appreciate that we are in one of these organizations that is such a rock of this community and has been for so many years. So again, thank you for your generosity in hosting and participating today. Thank you.
Thank you.
Thank you.
Thank you.